Many have suggested, for example, that we retire the word retirement. That there now would be a participation in our 50s, 60s, 70s, and even into our 80s that will include activity and also work, both in the traditional and the non-traditional sense. And so we then come to this huge opportunity from the standpoint of changing the face of aging that the business community globally is increasingly involved with. And I would suggest to you that there are three intersecting places where the business community is involved. One, and the core driver, is the marketplace itself. There is a growing opportunity for the 50-plus market for services and products. And you'll hear about this from a variety of sectors in a few moments from my colleagues here on the panel. This is about care, and providing care, but it is also about products in the retail sector. It's about products in how we manage what we used to call retirement. It is products to keep us healthier and more active. The second component that business is involved with is how it reforms its own way of looking at its workforce and its workplace. In this new world, what is the role of business with respect to those working for the companies who need to have a different kind of flexible approach with respect to the care giving that they will provide? And there's a growing interest and movement around that. And you will hear some around that as we discuss some of these opportunities. And the third is, what is the role of business in the context of it providing a kind of social support? The notion that we've come to understand as social responsibility that business might apply toward education, toward maternal child health, toward the environment, and now toward this challenge and opportunity of population aging. So with 1 billion of us over 60 in the next few years, this is a huge marketplace. And I would suggest that a way to think about this is how population aging will change how business engages in the market and how markets will change population aging. If markets can drive economic growth, that presents an opportunity to think of people in their 60s, 70s, 80s, and beyond in a very different way than we came to understand it in the 20th century. Changing the face of aging is an opportunity, and it will happen as much, I would contend, as a result of the marketplace and business driving that as it will from public policy itself. So with that, I'd like to introduce those my colleagues on the panel. I will introduce them in order of how they will speak, which is not the order that we're up here. Marco Merslick is credit analyst at Standard & Poor's, and the person who is largely responsible for some of the most seminal work in this field from S&P, the Global Aging Report in 2010 and the Global Aging Update Report in 2013. Dr. Hans Groth is a general manager of Home Instead, one of the most interesting new models of the delivery of care anywhere on the globe, I would suggest, and he'll talk to us about that. He's also president of the famous and infamous World Demographic Association, the WDA, which is based in St. Gallen, Switzerland. Or, to scarily, I apologize Turkish pronunciation, CEO of Aegon, and we're delighted, Aegon Turkey, and we're delighted to have you, and we'll hear about your retirement studies that Aegon has been engaged in. And Cem Küçük'ün, General Manager of Turkey Nutrition, very exciting company in the nutrition arena, healthcare, and providing innovation in the nutritional area for all ages, but including those who are living longer and looking to live longer. So, delighted to have all of you, and perhaps we can jump in, and Marco, you can start. Thank you.
Good morning, everyone, and I'm very happy to be here. It's early, but I hope some of the slides will help you wake up in the coming minutes. So, at Center, of course, we have been analyzing the demographic impact of aging on budgetary positions for a very long time, at least since 2002. However, in 2010, we published a research that was much more comprehensive than the previous ones because it was including a good set of emerging market economies. So on the whole, we are now looking at 50 different economies across the world. And in this respect, we cover more than 2/3, well, actually almost 3/4 of the world population. So really, it's reflecting how global this challenge is. Now in our study, what we're looking at is, just get this slide. So what we're looking at are long-term projections for a number of different budget items. For example, pension spending, long-term care, healthcare spending, and where available also employment benefits. And we look at them over the long term. So between 2010 to 2050. And we analyze what's their impact on the budgetary performance or position of a certain country. And as you can see, quite nicely, in a number of countries we observe, in emerging economies, we observe a significantly higher expected increase in age-related spending than what we expect for advanced economies. This reflects, in our view, one of the issues that this is reflecting is actually the rapid aging that some of these economies will be undergoing in the coming decades, besides what we believe also relatively low coverage, which will increase and as such will contribute to a higher increase in age-related spending. Now, one more thing that I would like to say here is that in many respects, or at least a large body of literature is suggesting that healthcare costs may be increasing faster than what we currently believe. And the reason for that is not demographic, but rather non-demographic factors, which are the main drivers of growth in this cycle. So technology, IT coverage, social security coverage, etc. And in this respect, as you can see, Turkey doesn't perform particularly well. But to give you a somewhat more reassuring picture, on the whole, emerging markets seem to be facing relatively lower fiscal challenge compared to advanced economies. For example, we're here portraying net debt in 2050 between our report in 2010 and another one in 2013, and we see that there has been, on the whole, relative improvement because, especially in Europe, there have been many pension healthcare reforms trying to reduce the fiscal cost going forward, and this has definitely an impact on future projections. However, as you can see, many of the so-called emerging market economies are performing relatively better, and that is basically because we foresee that or project that they would have relatively higher economic growth rates rates over a long period of time. And this is also coupled with currently relatively lower budgetary balances. So, say lower deficit, lower debt burden currently, which means that they still have room for some growth in terms of fiscal cost. And this is profile for Turkey. The UN population projections indicate that the population will grow from about 73 million to more than 90 million in 2050, but that at the same time, of course, the population will be aging from what is currently very young profile, 9% of old age dependency ratio, to 30% old age dependency ratio, which in itself is not indicating a totally old population. I think 30% old age dependency ratio is something that many of Western European countries are approaching as we speak. However, it indicates the shift, how quickly it actually will occur over coming decades, and definitely present a challenge to the policymakers on the budgetary side. For example, legislative spending is expected to increase from 10% of GDP to almost 30%, or 26%. And in a so-called no policy change scenario, implying there's no change to contain these pressures, we would be seeing budget balance or budget deficits building up, leading to quite a high increase in government debt. And Standard & Poor's, being the rating agency, what we do is we take all these projections and build them into so-called hypothetical ratings to see how creditworthiness will develop over the long term. And as you can see, what I briefly explained, the ratings of the colors between green and yellow are relatively good ratings, relatively good creditworthiness, which, as you can see, will be maintained until mid-30s. At that point, the impact of aging kicks in, and the creditworthiness evolves or deteriorates very rapidly. Maybe before I conclude, I'll just say that while many of the countries, many of the currently so-called emerging market economies are definitely aging with a background of relatively healthy economic growth rates, they nevertheless present pressures, as probably the increasing prosperity in these economies will put policymakers under pressure to increase, say, social security coverage, and in that respect, the economies, of course, can learn something from also the currently advanced economies that will, in order to implement policies that will be still fiscally sustainable in order to maintain some of these pressures that they. Thank you very much.
Marco, maybe before you, thank you, that was excellent. So the S&P has been sounding this alarm governments for at least 7 or 8 years. The 2010 report was perhaps one of the most seminal studies of its kind. Do you see, and it relates to what many of us in this room, many of us at IFA understand this population aging challenge, but we sort of shake our heads and wonder why isn't everyone paying the same kind of attention to that topic as they are to other topics in the global agenda. Has your data caused some shift, you think, or how would you assess that?
Well, I wouldn't say that our data has changed completely the mindset at all. I think we hopefully contributed to raising the awareness in the policymaking arena. But I think partly what has happened in the last few years can be clearly seen in this chart. So the pension reform, the number of pension reforms that have occurred in Europe over the past 2 or 3 years has been really overwhelming. We've seen them being implemented really across the wide number of countries, implying that the policy debate is there, that the research agencies like ourselves are contributing to this, that conferences like this one in particular are also raising the awareness and putting, very important questions on policymakers that need to address them. Global aging is here, population aging is changing the demographic profile of countries, but also of economies. And as we will discuss later on also, this has a very important impact on employment structure of these economies. But yes, we have been seeing a number of improvements across the world, and hopefully we can continue to contribute to this debate.
Thank you. So we'd like to now ask Dr. Hans Groth, General Manager of Homestead and President of the World Demographic Association, to give us a few remarks. And Hans, I know you'll be able to take both hats and tell us a little about the care model and some of the insights from the WBA.
Good morning, everybody. It's a special privilege to talk this morning on a Sunday morning to you on a very exciting topic. And as well, it's the first time in my life that I talk on Sunday morning before church. And therefore, that's my first question to us is, we are here this morning in a business panel, and the big question is this from the business perspective? Does it matter? Does aging matter from the business perspective? And I would like to answer this question with a recent survey from the World Economic Forum, where they asked a huge amount of executives in their global risk report, in your strategic thinking, what matters. And what you can see on this slide, the management of population aging ranks number 5. And I think this answer clearly expresses there's a need that we have to address this from the business point of view and come up not with obstacles, we have to come up with solutions and new models. And therefore I would like to go through with you 3 questions in the next couple of minutes. First I want to briefly review what we think about the dynamics of global aging. Then I would like to come or comment on the business model of Homestead and why it matters, and to discuss with you if it makes sense, the need for this business model. And finally, I want to make some brief comments what we can already learn from Europe to enter in the 21st century in new and successful business models. And I think this slide is more or less a repetition, but it's a very important repetition. We have both in business, politics and society to understand the dynamics of population changes, population dynamics both developed, developing and in the emerging nations. And the big thing is what we all have to learn, that the dynamics in the rich countries in terms of aging, they are significant, they are double-digit, but they are not as tremendous because they have already developed there as what is about to expect in the emerging countries and in the developing countries. And just, you know the example of China, and you know maybe as well the challenges of Africa. And just one more repetition, we are in Turkey today, and as well Turkey is one of the countries who will be affected by significant aging challenges, which are at least double as much or even more than what we will have in Europe or the other developed nations. So the business is challenged, the business must make a contribution, and the business has to develop new business models to make this new world in the 21st century working. So once again, you see here the dynamics, what we expect in Turkey. Right now we have 10 million people, 60 plus, and this number will go up to 25. You see what a percentage increase this will be. So Let me come to question number 2. Question number 2 is to ask myself, personalized home care, why, how, and where? And personal home care is a new product in the 21st century. It's a new product due to increasing aging populations, number 1, and number 2, due to changing family structures or changing living conditions. And before one can build up a business of home care, personalized home care, we have to ask, or we have to have evidence, does it make sense? Why? And I've summarized on this slide some key research we did at home instead about the rationale or the market perception of our business model. And what are the facts? Do people appreciate this? Is there need? Because need is always the prerequisite for demand if you can finance it. And the key figure you should take home, up to 90% of seniors wish to remain at home. They don't want to live in nursing homes in boxes. And this is the individual component. There is as well a healthcare or a healthcare financing aspect. By offering or introducing effective personalized home care, you can develop or you can demonstrate in many aspects that the medical expenses, the expenses for medical care, not care, medical care, will be reduced. And we can prove this. Number 1 is by the way, or by the compliance of medication, by the number of doctor visits, or even by the number of days people stay in hospital. So if you do the math on this, at the end of the day, the savings in medical care provided by personalized home care exceed the investment for home care. So you have a positive value, and not only financially, as well personally and by the families who are relieved by having this additional service. And this was why. I think hopefully I have convinced you that our business model of personalized home care has convinced you. The next question now is what is personalized home care about? Basically, it's giving attention. Basically, it's engaging people in their home atmosphere. It's about companionship. It's about personal care, and in very severe disease states like Alzheimer's, Parkinson's, diabetes, etc., it's specialized care. This is the segment: companionship, personal care, specialized care. If you maximize these services, the benefits I've discussed before can be made effective. So the next question is, where is this service available? I know service, personal care is a very individual product, very individualized medicine. And home instead is, we have developed the concept of personalized care, but we haven't developed this concept just in a single city. We are in the process of making this concept available across the globe. And you can see here the countries where we are currently operating and the countries which are highlighted in red are the ones where already doing business in Europe. But what you can also see, although we are quite active in Europe, there are a lot of spots where we still don't have business, but this is on our horizon and these are our plans. And principally, these services of personalized care can be applied everywhere across the world, and this one of our objectives. Now, let me come to the last question, lessons from Europe. And I want to give you two answers or two comments on this. Number one is the so-called WDA model for competitiveness in the 21st century. What we think at home instead, that our business model will only be successful and only can be used and called for once we manage our population dynamics in a successful way. And basically what this model shows you, at the end of the day, we all aim for societies which maintain both welfare and wealth. And once you have these, you will have the assets to afford in the final stage of your life the benefits, and sometimes they are costly, of personal care and elderly. And the homework to maintain or to create welfare and wealth in the 21st century is reforms in work life, improvements in the financial markets, continuous improvements in health, and revised pension models. And once we have done these homeworks, both on an individual, family, company, and nation level, we are in huge competitive advantages, and then as well can benefit and afford a care model in the 21st century with very high quality and ethical standards. And the last slide, as always in business, you can only proceed based on proper research and knowledge, and because this is the starting point for any innovation of products. And we as well need innovation in products. We offer at home instead, we need innovations in care products. And for this, we do at the University of Sangha a major research project on new job profiles for nursing and care in the 21st century. And the key objective is to make longevity an achievement and not a cost factor. Thank you very much, and I'm looking forward for your questions.
Thank you, Hans. I'd like now to introduce Or, thank you, CEO of Aegon. Some of you may know Aegon, a Dutch-based global company, has been engaged in really a spectacular set of work over the last several years on what they're calling retirement surveys. And it's being done globally, and they're finding out a great deal of information, research, and data, which we think will be very much ability to inform all of us on how to think differently about this era in which we have to, many of us will accept and agree, rethink, reimagine what we used to call retirement. There are those who have suggested that we retire, the word retirement even. So we'll be very interested in what your data is teaching Aegon and perhaps teaching all of us.
Thank you. Thank you, all of you, for joining us today at the very early hours of a Sunday morning. I'd like to share the key findings of the survey that has been conducted by Transamerica, an American company in the US, and Cicero Consulting. I'd like to start with the slide 3, if it's possible. The objective of this study is to provide a clear picture about the global retirement readiness in 2013. The survey assesses the readiness of individuals and examines the rebalancing of retirement-related risks, and offer recommendations of how individuals can be learned or can be helped to understand first and protect themselves against those risks. Slide 3. The survey encompassed 12 countries. In each country, 1,000 respondents joined. And among 1,000, 100 of them were retired already, 900 are working people. It doesn't, the scope is not covered, that doesn't cover the self-employed people. The survey concentrates on the working people. In the slide 4, I'd like to first share with you the first key finding: the lack of retirement readiness in an emerging global crisis for governments, employers, and individuals. As you see, we have prepared an index. We call it ARI, Airborne Retirement Readiness Index. And you consider 2 different years, 2012 and 2013. And the total ARI score has dropped from 5.19 to 4.89. All of the countries that participated in 2012 has also faced the declines despite the positive signs of economic crisis. I mean, in 2012, people felt more severely the economic crisis. Despite some signs, positive signs, people think that the things will not be going better, but worse. In slide 5, most of the people expect future generations will be worse off in their retirement period than the current retirees. As you see, approximately 2/3 of respondents believes that the future generations will be worse off. The pessimistic sentiment is highest in Hungary and France. When we, in slide 6, when we probe further into what may cause this negative outlook, we have found that the global financial crisis, but at the same time longevity, have created that expectations among the employees. Nearly 2/3 of the people or employees think that the government benefits will be cut back. Similarly, 44% of people think that the employers will cut back the fringe benefits related to the pension. When we further investigate the problem, in slide 7, we see that the young generations, particularly the age 18 to 24, think that they will be dealing with financing of their parents even though when they are retired. Such concerns may be well-founded because increases in longevity along with inadequate retirement income of the older generations may very well place this additional burden on the younger generations. As a result of that burden, in slide 8, you see that the majority of today's people thinks that one way to bridge the gap of retirement income needs is to work or transition, including part-time works. They don't want to stop their working immediately. They want to work as a transition. They want to come up to retirement period through the transition period. They are controlling, so I'm in slide 9. Slide 9. Okay. People think that if they continue or transition they think that it will be good. Yet this practical solution is not so realistic because we have found that many of the people retire earlier than expected, so because of health conditions. It is not so easy to keep on working. And also, in slide 11, you can see that the employers are not so ready to offer the people to have flexible or part-time jobs. I mean, you may think that you can keep working when, even though you reach retirement age, it's not so easy, either from your health conditions or from the employer's point of view. The fourth key finding is financial illiteracy. Those people, only small percentage of people thinks that their financial planning is well prepared, and but 39% of people do not know even they are on course to achieve their retirement income needs. So this index actually measures 6 questions. One of them is how you feel that yourself are responsible for retirement. Second one, the level of awareness. The third one, are you planning your retirement? Are you ready to invest your income? But when you look at the numbers, even though people think that they are responsible for income by themselves, but they are not putting their income, they are putting savings into their income needs for the future. Because they don't even know sometimes the consecutive effects of their income. If they don't invest today, how they will face tomorrow, it's not so easily understandable for many people. The fifth and the final key finding is that the people is seeking solutions. However, more than half of them say that they are ready to take some fewer risks in order to have protect themselves against volatile markets, because after the global crisis and after the longevity, it's not so easy to finance their income through a volatile environment. So that's why people want to see some positive solutions on that. I mean, if we summarize that, lack of retirement readiness is a global emerging crisis. Most of the future generations to be worse of retirement than current retirees. Delayed retirement offers obvious solutions, but obstacles remain. Widespread retirement illiteracy worsens readiness, and very about retirement later is individual seek solutions. So the people shouldn't feel themselves lonely. Government and employer and individuals should act all together to overcome those problems. What we are saying as a general that this crisis cannot be solved by only one part. Government, employer, and individuals should come and find common solutions. Otherwise, it will be a great global crisis in front of us. Thank you.
Thank you, Laura. Excellent research, and I trust there will be some questions from the audience in a few minutes when we get to that. And so when we think about the overarching landscape that we heard from S&P's analysis, move to the revolutions taking place in the care continuum, from our notions of institutional long-term care to our notions around personal relationship-based home care. No question that there are roles for business to think differently about that. And then that's added to the conversation from how business begins to think about and integrate this notion of perhaps a new role in our 50s, 60s, 70s, and beyond, where we're participating in external activities, including variations from low to very high of work. But of course, all of that will be contingent on health and wellness. And I'm delighted now, therefore, to ask Cem, General Manager of Turkey Nutrition, to speak to us about some of the very exciting work that nutrition is doing in this space. And I'm hoping that you will also be talking about what I believe is perhaps the global challenge before us in the world of aging, namely Alzheimer's, and that nutrition has some very interesting answers to that. Thank you, Jim.
Good morning, everyone. My name is Turyak and I'm working for the healthcare industry for the last 17 years, working in the different multinational pharmaceutical companies, and 4 years now with nutrition. And what is nutrition? Actually, nutrition is one of Group Danone companies. Danone is a food company that wants to bring health through food as many as possible to the greatest number of people with yogurts and water. And nutrition is a healthcare company. Our playing field is healthcare, and we focus on patients. And we want to establish advanced medical nutrition as an integral part of the healthcare. And nutrition has overlap for products, as you can see, from infants to seniors. Infants have specific needs in growth and building capital, whereas in adults needs products for maintenance and prevention, while senior needs adapted products for aging process and problem solving. And although nutrition established itself from pediatric category, it now focuses in the elderly care with the changing social structure and healthcare, and mainly in strengthening muscles and preventing measures of Alzheimer's disease. For more than 50 years, the governments, together with the healthcare systems all over the world, has done an incredible job to support doctors' care and cure. This has also increased the life expectancy. But the healthcare challenge of the 21st century will be different than the previous times. The challenge will be managing the consequences of the lifestyle diseases rather than fighting to infectious diseases or childhood mortality. And the challenge will not be longer life, but be healthier longer life. The future of innovation, healthcare, will not be exclusively pharmaceuticals. Some of the innovations will come through cultural changes, changing the roles of doctors, changing diets, changing lifestyles, and encouraging people to have a healthier life. And much of the innovation will come through nutritional products, with more acceptance of the nutrition's fundamentals role in healthcare. In the future, it will be critical to keep older people independent as long as possible. The active older people will continue to contribute to the social environment, and the big burden will come when elderly lose independence. So this is one of the most important charts that we'll be paying attention, which we're saying that as long as we keep our elderly mobile and active, the less the cost is to the society. And look at the car industry as an example. The car industry, partnering with governments and stakeholders had succeeded in innovating safer driving. And it was not the industry that came up with preventive measures. It was the society, it was the consumers that requested from the industry. And we believe that with right incentives and partners, we can work towards innovating in favor of safer, longer and healthier lives. Can we go? Yes. And the doctors and the healthcare professionals are not alone anymore. And the European Union stated a goal to add 2 healthy life years for every citizen. And partnering with the industry together with the healthcare professionals, patient associations, research organizations. But the next step will be to involve the most important stakeholders, who are governments and legislators, who set the rule for the healthcare. And do we have a specific role as a company and industry? Yes, we have. And our role is to develop innovations that work, to come up with products that make difference in the quality of life, difference in the quality of life elderly, and do it together with the stakeholders, governments, organizations, healthcare providers, and to dedicate ourselves in developing a more healthy aging economy in now and future. Thank you.
Thank you, Jim. Very exciting to see that intersection of health, wellness, science, and nutrition. We know the huge challenge that we have as non-communicable diseases come to the fore, having done so much success in the 20th century on communicable diseases. We're now going to spend a few minutes with a little bit of a conversation among ourselves, but mostly we will be welcoming questions from you and a conversation with you over the next 20 or 30 minutes. Perhaps to get it started, I'd like to offer you a quote. I see that, I hope I'm not embarrassing him, but I see that Ambassador Apakan has joined us. Welcome, Ambassador Apakan. Ambassador Apakan is the former Turkish ambassador to the United Nations and someone who has been leading in this field of aging and doing a great deal at the United Nations to raise the level of awareness of this topic, and now here in Turkey as well. You put it this way: aging is a phenomenon that has to be taken duly into account by developing countries. To put it scientifically, while developed countries will see a linear increase in their older population, developing countries will experience an exponential increase. One observes, for example, that in 2 of the oldest countries with the oldest populations on the planet, percentage of old to young, Japan and Italy. And Japan, the latest data is that by 2020, there will be more adult diapers sold than baby diapers. That's a reality, and the question is, how now, sitting here in Turkey, what is the business role? What can business do to address that so that we can get ahead of the curve in the emerging markets? Perhaps help and play a role in Japan, in Europe, in the United States, but in particular in the Turkeys, the Chinas, the Brazils, the emerging markets, which will see what Ambassador Apakan called that exponential increase, how we learn from that and get ahead of it. What is the role of business? And perhaps I can put that question to each of you sitting here in Turkey from your different points of view and your different companies. Sure.
Thank you. You know that after the burden of social security system and the government started the reform, and then they risked their liabilities on the shoulder of individuals by defined contribution, because they have changed defined benefits to defined contributions, and then they have increased the retirement age, and so that conditions people felt themselves in an unsecure environment. So what we can do in Turkey, we are saying that we didn't experience yet that half of the population is still younger than 30 years old. On the other hand, we are also getting older and older. But it brings also financially insecure environment. So what, as a Turkey, we are working on annuity products, which means that people feel themselves unsafe in volatile environments. So if we could design a relatively flexible, on the other hand, relatively unvolatile products, which will give them a retirement income, a reasonable long life, whole life annuity products, then it will help them to design their future income in a very well established way. So we are working on it. On the other hand, healthcare is another issue that we need to take care because we have some institutions in Turkey. On the other hand, in a private sector should take role of that part as well.
Thank you. Interesting, exciting, and a market answer to doing things differently in the 21st century as a result of this demographic shift. Others of you, any comments?
Just in the context of Turkey, or Turkey's projections, and what we have been observing, or what's there in the store is actually quite a significant increase in expenditure spending. And that, I have to say, is based on a relatively small coverage of pension, because what we observe is that there are relatively generous plans for a small proportion of the population. And in terms of healthcare, I think, as the country grows and develops, there will be more of demand for additional spending, which is good, I think, because it enables the country to grow healthier, for people to live longer, and maybe that's the component where, the experience here will be exponential to that of advanced economies. Now, finding a solution that will benefit both, so the user, consumer, taxpayer, and the government is always a tricky one. But I think unless there are structural reforms in that way, we may be observing what we have actually observed in June, where people in Brazil were in the streets or surrounding the football championship asking actually for more healthcare. So unless this is done gradually, I think there may be potential social pressure.
Maybe one on my side. There are many measures taken by the Ministry of Health. You can see a lot of public spots on the TVs fighting for obesity and becoming a more active nation per se. And our job as companies is to bring products on the market that will help not for preventive measures, not only for physical well-being, but also for mental well-being. And it is a society, so it's not a one-dimensional approach, but physical, mental, and the society should work together to come up with some preventive measures. Just to give you a concrete example, with just a simple ID in Turkey, with an identification number, you can go to each and every hospital in Turkey, get examined, and buy your products without any charge from the pharmacies, which is increasing the cost of the healthcare system in Turkey. So it is creating a huge burden for the social security institutions. So what the future will bring will be the preventive measures, because there has been a huge scrutinization from the social security perspective. And I think our job will be to take some preventive measures and to prevent our elderly to become sick and be as active as possible.
Yes, and on that point, it's often been said that if we could start thinking of spending on healthcare as an investment rather than a cost, we would get a different construction of how public policy follows. I would suggest for us to consider that society generally thinks of spending on children's education as an investment in the future, as I personally believe they should. But now with the aging of the population, wouldn't we be better to think of spending on health as one of the components as an investment in 30, 40 or more years that people will now have to live, participate, and become a contributor as opposed to less and less of a burden? Hans.
Let me make a comment from the perspective of the third or fourth phase of our lives. If you go back to the 19th century, we had a very classical lifespan. We were born, we were educated. Once we were educated, we started to work, and then as soon as we stopped working, we died. And this is why Otto von Bismarck back in 1884 could restore his pension reforms, because he made promises for people who never got it because they didn't get as old. And what we have done in the past 150 years, we just have expanded or exploded this model of social contracts. But what do we have now in the 21st century? We have a lifespan of, let me say, retirement or reduced work of 30 years, from 60 to 90. And now the question is, how do we finance this? And at one stage, this plan is as well associated with more care. And the question is, and I've shown you in the introduction the numbers, these numbers of increasing elderlies who demand, who are real need for this care, can never ever be financed by public budgets. I cannot imagine this. So the question, and this is as well the role of us here as leaders, how can we develop the literacy that we all have the self-responsibility to make our own lives an achievement and our own aging achievement. And for this, once again, therefore the pension industry or the workplace is sort of important. We need a model and consensus across society that we all need tremendous savings to make this an achievement. Or the other option is we really work till 90 when you don't need savings. So this is the cutting point. And I would really like to hear your opinions on this. And once again, we acknowledge that we believe in our model of care. It is very intense, but it's very tailored to the needs of individuals. But even if the salaries of the caregivers are moderate, it's the amount of time we spend. It's extremely costly, and you cannot finance this model exclusively by state budgets. It's impossible.
Thank you. On that end, Jim and Gore, you both mentioned the relatively younger population in Turkey today, which we know is true of many emerging markets and developing countries. And you very nicely put the need to plan for the future as these low birth rates continue. I recall 2 years ago sitting around a table at the Asia Pacific Economic Council, and that was with Japan, South Korea, and several of the other countries with these very, very old populations. The most passionate and articulate minister around the table was the Minister of Health in Thailand, which, as many of you will know, has a relatively young population. And she basically said, we know where we're going 30 years from now and have to start planning. So it's very interesting. We're doing some work in Thailand, and we're looking for some input on that. Perhaps we can open up to questions. I see a lot of friends, and I hope there's a microphone that you could give. Yes, please.
Thank you very much for excellent presentations this morning. They've all been really, really useful, really interesting. My name is Ruth Marks. I'm a director of the IFA, and I work in housing and care in the UK. And we've heard about personalised home care this morning, and also the importance of retirement planning. And for the staff who are actually working in the care profession, their wages are often very low, and from our own research, their own levels of literacy are often very low as well. And I'd be interested particularly in Dr. Groth's and the gentleman from Aegon Turkey's views on how we can plan and support for people who are either not able to work or who are working in very low-paid jobs, how we can help plan and support for their retirement as well as everybody else's. Thank you very much.
Thank you for this excellent question. If I understood them correctly, you asked us how can we make sure that people who are in lower paid professions, how can we make sure that these people as well develop funds for pensions? Number one, this is a really hot topic, what you said, but colleagues from the insurance will correct me if I'm wrong. Currently we have, at least in Europe, a trend that the number of people with low wages is increasing, or people have numerous jobs and this will cause troubles, and you have already, you're always the expert on this, which we will be confronted in 20 years. So, in an ideal world, this cannot be accepted, and we in St. Gallen once developed a concept because we firmly believe you have to save, and we have been so radical at that stage that we even said you have to start saving at the day of birth, you know. And maybe the model, and I still believe in this model, and we invented this 5 years ago, and had a quiz on this. But with longevity, you can save, when you start saving at your birth, you can save for 70 years. When you have huge compounding effects on your capital, so you can make very safe investments. Now, where you have to be creative, who funds this? And my idea is at the beginning, maybe the parents pay a little bit, or the grandparents, and then you have to do this, and if you cannot, at the end of the day, this is not my primary solution, but the state has to compensate this. Because at the end of the day, if they don't compensate, they pay later this for other social services. So, but you're very right. We need, because we need sustainable investment, we need long-term investment for retirement. And what we haven't done in any of these plans, in the private plans, we can capture the dividend of 50 years.
Okay, the minimum wage is a problem not only for retirement period, but at the same time working period as well. So if you think proportionally, if I'm only less minimum wage, so probably I would live in line with their conventions. Proportionally, if we save from today onwards, and if we don't give up saving, it will help for your future income. Plus, employees should be incentivized because it is, not only the government, but the employer should take responsibility to secure their employees' future. But it will also help in the long run, in an indirect way, to increase the prosperity of the community. So by this way, they will also get the benefit of it. It should be either the individual, not only the government's issue, not only the employer issue, not only the individual issue. All three pillars should work together to overcome that global crisis.
Truly an excellent question. As we're going to the next question, perhaps I can offer a couple other thoughts on that point. We first to admit that these are somewhat disparate points, but at least part of the mix of how we get to solutions. Number one, the real issue is going to be the supply of caregivers. As we look at living beyond 80, no matter how excited we all are to have us participating and working more, there is still that slide that Jeremy showed where someone stopped smoking at 47, they started doing good exercise at 53, et cetera, and at 91 they died anyway. So, whereas my father used to say, no one made it out alive. And we all want to compress the amount of time that there are bad years, but the explosive need for caregiving will be utterly huge. The second point I would make is that this is not a new story. I know it is true in the developed world, and certainly in America. I do not know if it is true in other developing countries, but I've been horrified at the low wages that teachers of our children get relative to other professions in society. If one were to provide wages, compensation on the basis of value and future value, my daughter's first grade teacher should be making a lot more than many CEOs. So maybe we can learn something from other arenas which have failed to change the paradigm. The third point I would make is to highlight the point that Gurr made. Those of you who were here yesterday about midday heard from Sally Sussman, Pfizer, and their program around Get Old. Well, they have another program that is beginning to roll itself out called REACT, Respect the Caregiver's Time. Right now it's, I think, only in the United States, but hopefully it will be beyond. And it's basically the notion, again, that the dirty little secret is that the corporations and the businesses that pay attention to the needs of caregivers as their employees will actually be more competitive. And there may be some components around that will help this wage differential as well. So just a few other thoughts. I hope there's some more questions. Yes.
Thank you. And I was hoping that comments would move in that direction, because this is kind of an extension of Ms. Mark's question as well. But I think for the most part we've heard a lot about what's the responsibility of government and addressing these needs, generally spoken of in terms of increased public expenditures or reforming pension systems. I'm not sure what reform means there. And a lot of attention to individuals, the responsibility of individuals, and the assumption that they need to be changing their behaviors. I still don't feel like I've heard too much about true corporate responsibility as that third member, as the gentleman from Aegon was referring to. It seems to me that, at least in the United States, corporate profits have been very healthy. I think partly, I'm not an economist, question my assumptions, but part of that is due to increasing productivity that's come about as reducing the size of the workforce pretty dramatically over the last few years. And secondly, reducing employee benefits by moving from defined benefit programs to defined contribution programs. In other words, a massive shift of the responsibility for these things to the public and now to the individual. So my question is, what is the true social responsibility of the corporate world in this matter? As I understand it, the corporations in the United States are sitting on trillions of dollars in cash waiting to invest when so-called the economy turns around. And just to be a little more pointed and without putting Mr. Roth on the spot, my understanding is that the Home Instead Corporation testified against the inclusion of home care workers under the minimum wage law in the United States. It still hasn't been entirely resolved yet, but home care workers are not covered by the minimum wage law because they're considered companions. So I wondered how you feel about that and whether the company has taken an official stance on that.
I guess the first question around corporate social responsibility or home estate.
Let me briefly comment. I tried to do this in my previous comment on what we pay to caregivers. Now, one is, this is true, we are a professional company who have thousands of caregivers, but once there is growing demand for care, and as well the number of caregivers are not unlimited, so we as well have business development, and we know as well that we have to have competitive ways to pay these caregivers. But on the other hand, there are as well some very clear limitations to the level of care what we pay. At the end of the day, can never ever be the same salaries as what I usually in the banking or insurance industry. But we will find a model which is as well socially responsible.
So maybe I'll provocatively attempt a response to your social responsibility question, which is simply to say that I think it's the wrong question. The way you will ensure business in general and corporations in particular to do what I believe all of us in this room want them to do around this aging population's challenge is when it is embedded in your competitive interest. That will drive the real change around flexibility in the workplace. For caregivers who are employees will happen when it's in someone's competitive advantage. So corporate social responsibility is a nice to have, but I would suggest that building that into markets and competitiveness is the way to ensure change in behavior. And personally, when you look at the exploding aging population globally, it's hard to imagine that will not happen very, very rapidly, and we will get a change in behavior as a result. Other questions?
Jeff Heelan from New Zealand and Australia. I'm interested in how this discussion is moving from the business opportunities that are there for business through to issues of social corporate responsibility. Where I want to take it to next is a question really around how prepared is business itself for an ageing of its own workforce. Often I find the case is that organisations will look externally at the ageing population, understand that, but do not look internally. In my own country, in New Zealand, a recent report has just come out which says that around about 3% of the current labour market is over 60. Projection is by 2031, that's going to be around 12%. That's 12 in every 100 workers will be over the age of 60. The estimate is about 31% of people over 60 will still be in some form of work. And so my question to you as business leaders is, in terms of your own companies, what are some of the risks that you see yourselves facing, and how are you attempting to engage with the changing structure of your workforces?
In our country specifically, since the Turkish population is still young, I don't foresee any big threats from that perspective. We are not ready yet as well to offer, as I tried to show in my presentation, that only 1% of employees are ready to offer different kind of working conditions to their employees when they are retired in the 12 countries. However, in Turkey, if you reach 60, normally you are retired. Although the current age is gradually 65. If you are, for example, for me, it's from social security system, I will be eligible to be retired around 52. So from that perspective, still we are young, and still we don't face any problem. However, 12 developed countries or the developing countries, or many countries have faced that kind of problems. We are learning, and then we will take proactive precautions to overcome that kind of problems that are there.
Maybe to complement Uğur, I'm 43 years old, and in Turkey I'm managing a company of 225 people. I'm the third oldest person in my company. So, you know, the population is still young. The average is 27 years, and I think we have a lot more priorities to come and to tackle this notion and learn from our colleagues in Europe, but we have other priorities in Turkey, and I think it will eventually come as we will get older, but when you put a priority list, I think it's not the most priority thing that we have to tackle in Turkey.
I think in our case, when you just look at it, I think it's, in terms of working environment, it's an office environment, and we have available schemes for sporting activity, for pension planning, etc. I suppose like many other companies in the sector. Having said that, the profile of the demographic profile of the company is not skewed yet towards, say, the elderly. However, aging being the process, I think some of these benefits are captured throughout this period.
Let me make a comment or address a question to the audience. I'm becoming 61, and what is your definition of working? You know, once we become older, because one thing is obvious: once you're more experienced in life, your priorities switch a little bit, and before we sometimes demand or post demand for longer working periods, that's a discussion. What is working when you're in the 50s? What is working when you're in the 60s? What is working when you're in the 70s? And for example, my mother, she has a dentist office. She was active, I think, till 75, but she had a different definition of working. So I will be keen to hear some comments from you, and then I give you my answer.
Thank you. So I believe I would like to have time for one more question, but we do have to I promised the IFA leadership that we would hand out the awards, thanking each of our panelists. Laura, please. Thank you. Thank you very much. Hans? vote. And Jim, I might have given you each other, so you have to stand. You actually have your names on it. So thank you all for, I think, what was a very good discussion. And I'd like to now invite the next panel up. You know who you are. Thank you for your attention.
Good morning, everyone. Rob will come up and be moderating shortly. I'm just giving a little announcement that the program you would have noticed there was no coffee break this morning until lunchtime. So in reality, we will be having a coffee break after this next session. So there will be coffee and tea out for everyone after this session.
Great, thank you very much. This is, I think, one of the most important sessions we've got. Cities of the Future. This is the opportunity for us to talk about our urban environment, the environment in which we live, the environment in which we'd like to live, and move the cities across the world. We already have one speaker on the stage, Mr. Hussein Erin, who is our special and honoured guest, Deputy Secretary of the Metropolitan Municipality of Istanbul. Those people who have seen Istanbul change through the years, I think Mr. Erin has been personally responsible for those magnificent changes. We've also been joined by David Bryan, and I'd like to call up Martin Reza and Gary Lawrence to join us as well. Before we actually start the session, and we'll hear from Mr. Erin first, many of you have been here yesterday for one of the highlights of the session, which in fact was the announcement of prize winners. One thing that wasn't done is, unfortunately, the finalists of those prizes weren't announced. And I'm happy to do that today. The finalists of the Best Existing Age-Friendly Initiative was Hong Kong Housing Society, Hong Kong, Kimber in France, Human Endeavour, Canada, I2I Intergenerational Society in Canada. They're being congratulated. And the finalists of the Best Future Vision of an Age-Friendly Initiative were Kilkenny, Ireland, Los Altos, California, Vietnam Public Health Association, and the City of London in Canada. They also were the finalists for that particular prize. And it's also important for me to thank the international jury that did such an amazing job in evaluating all those applications and making the decision that you heard announced yesterday. So now, back to today's session, or this morning's session, Cities of the Future. To start, again, as I say, it's my honour to invite Mr. Hussein Erin to begin our session today. Thank you.
Saygıdeğer katılımcılar, İstanbul'da yaşayan biri olarak, ev sahibi olarak hepinize öncelikle hoş geldiniz diyorum. Ben İstanbul Büyükşehir Belediyesi'nde yaklaşık 20 yıldır idareci olarak çalışmaktayım. son görevim de bu Dar Acize'nin de bağlı olduğu birimlerden sorumluyum. Bugünkü konferansımızda, panelimizde geleceğin kentleriyle ilgili kanatlarımızı paylaşmak istiyoruz. Öncelikle şunu belirtmek istiyorum. Gelecekten kaçılamıyor. Ben kendi ailemden bir örnek vermek istiyorum. Avrupa sanayi devrimi sonrası büyük aile yapısından çekirdek aile yapısına geçmeye başlamıştı. Tabii 100 yıl aşkın bir süre. Benim dedem 1920'li yıllarda bir mutfak, bir yatak odası yaptırmış. Dedemin kardeşi evlendiğinde hemen onun yanına bir yatak odası eklenmiş. Babam evlenirken bir mutfak, bir oda daha eklenmiş. Amcam evlenirken onun yanına yatay sevilen bir dış kapıdan girilen bir koridordan odalar, otel gibi. Ama bir sofrada yenilip içiliyor. Tüm aile bir arada. Dede, nine, çocuklar, dedem, ninem gelinlerinin kucaklarında vefat etmişlerdir. Tabii bu dediğim yıllar 50'li yıllar. O tarihlerde Türkiye'de %75'i kırsal kesimde, %25'i şehir ve kentlerde yaşamakta. Yani ağırlıklı nüfus kırsal kesimde. Yavaş yavaş şehre göç başladı. Şehre inildiğinde şehrin kıyısından herkes bir ev, arsa aldı. Bu sefer yatay değil de dikey büyüme başladı. Dış kapılar ayrı. Yemek yine bir sofrada yeniyor. Yemekten sonra yatmak için bir üst kata çıkılıyor. Ama bugün gelindiğinde artık Türkiye'de de bir yapı fevkalade değişti. Nüfusun döndüğü için kentlere dörtte bir kırsalda kaldı ve dolayısıyla çocuklar işleri gereği ya bir işe girmişler veya memur olup değişikliklere gittikleri için Türkiye'de de bu yapı çok değişti. Orijinal bir örnek vermek istiyorum. 1960'lı yılların başında bizim köyümüzden Almanya'ya ve diğer Avrupa şehirlerine işçi göçü başladı. Bir yıl, 2 yıl sonra köye izne geldiklerinde şu ifadeyi ben de duydum. Almanya gitmiş. Almanya perişan. Nasıl perişan Almanya? Anne baba ayrı, denenle ayrı, çocuklara ayrı. O kadar kültür bize farklı geliyor. Biz o 60'lı yılların başında dede, nine, torun, çocuklar, anne baba hep aynı sofrada yemek yiyoruz. 15-20 kişi oldu bazı aileler. Almanya okumuş şartlarında çekirdek aileye geçmiş. Yani herkes ayrı ve hatta şunu çok üzülerek ibadetinden buluyorum. Yani yaşlı dedeler kesinlikle çocukların yanında değiller, hatta huzur evlerinde. Herkes yanında kalmıştı ama bugün Türkiye oradan 50-60 yıl sonra aynı konuma geldi. Türkiye'de de bugün fevkalade huzur evlerine, yaşlıların ihtiyaçlarını giderebildiği merkezlere daha fazla ihtiyacı var. Demek ki gelecekten kaçınılmıyor. Bunu özellikle ifade etmek istedim. İstanbul, 2 kıtada yer alan büyük bir metropoldür. Coğrafi, tarihi ve kültürel zenginliklere sahiptir. Türkiye'nin ekonomik, ticari ve turizm yönünden en gelişmiş kentidir. Hatta diyebiliyoruz ki Türkiye'nin yarısı. Çünkü ticari hayatın %43'ü İstanbul'da, Türkiye nüfusunun %17'si olmasına rağmen, hatta ihracat ve ithalette %65'i İstanbul'da gerçekleşmekte. İstanbul gerçekten Türkiye'nin yarısı. Dünyada sanayileşmiş ülkeler başta olmak üzere yaşlı nüfus giderek artmakta. Ülkemizde de durum böyledir. Doğum oranı ayrı olmasına rağmen sağlık koşullarının iyileşmesi yaşam sürecinin süresini uzatmaktadır. Ülkemizde 65 yaş üzeri insanların sayısı 5,8 milyondur. Ülke nüfusunun yaklaşık %7,5'una tekabül etmekte. İstanbul'da 14 milyon insan yaşamakta, yaş ortalaması 29'dur. Yaşlı sayısı ise 800 bin civarında, 5.7'ye kısmı teşkil etmekte normal. Türkiye'de kentleşme ve sanayileşme aile yapılarında da önemli değişikliklere sebep olmuştur. Ataerkil aile yapısından çekirdek aile yapısına hızlı bir geçiş yaşanmaktadır. Bu değişimlerden en çok 65 yaş üstü gruplar etkilenmekte. Ataerkil aile yapısında söz sahibi ve otorite olan bu aile büyükleri güçlerini kaybetmeye başladıklarında bu onların zerdesiyle mutsuz kılmaktadır. Yaşlı nüfusun diğer yaş gruplarından daha hızlı artması, kent yaşamında bunların ihtiyaçlarının karşılanması ihtiyacında olmuştur.